Hi, I'm Bob Orr, and this is Washington Unplugged. Well, Christmas is coming early for embattled Senate Democrats. The final vote on health care reform happens at 8 a.m., about 13 hours earlier than originally scheduled. The passage seems assured, and that means senators will likely make it home in time for the holidays. But the fight is not over. Senate and House negotiators still have to come back and reconcile their two versions of the bill, and they are very, very different. For example, should any federal funds be used to cover abortions? Should there be a public option? Just a couple of the difficult questions ahead. So what happens next? Joining me to talk about this today is Craig Gordon. He's the healthcare editor for Politico. Hi, Craig.
Hey, Bob.
So what does happen next? It looks like the vote is greased now. The Senate will get its version, then they'll all take the holiday break, but then the fight starts.
That's right, and we're told the staff is going to work a little bit in the week between Christmas and New Year's, trying to bridge the differences between the House and Senate bills, and there are pretty significant differences. The House still includes a government-run health insurance plan that Obama talked about. That's not going to make it into the final version. I think everybody agrees about that by now. The two houses also pay for the bill differently, have different mandates and requirements for employers and employees to have insurance and such like that. So there are actually a lot of big differences they have to work out, and they really don't have a lot of time to do it. President Obama was anxious to get this done before the State of the Union, but Politico learned this morning that now they're actually thinking that probably will slip at least until February, a sign of just how tough this negotiation is going to be.
So that's some news right there. You're saying because of the busy congressional calendar, they might not get down to brass tacks till February?
I mean, they'll be working on it pretty much through the month of January, but I think now the White House is pessimistic that they could get a deal ahead of the State of the Union. Look, President Obama is anxious, I would say almost desperate, to turn to the question of jobs and the economy. They've been really trying to get kind of health reform out of the way. It doesn't look like that's going to quite happen in time for the State of the Union, where he had hoped to make a big announcement. You know, I have delivered health care reform. So the negotiations will be going kind of hot and heavy, but I don't think you'll see a final deal struck until early February.
Now, I think it's no secret that the liberals in the House especially are not very happy with everything that's been tossed out of the Senate version. What is the chance, if any, that we see some kind of liberal revolt here and they listen to the Howard Dean message and say, hey, you know what, this isn't good enough, well, let's come back and do it again?
Quite honestly, I don't see a lot of chance of that. I think you do have a lot of rather angry liberals and progressives in the House. They fought for the public option. They're not going to get that. They fought for more generous subsidies to help people buy insurance. Some of those got watered down in the Senate bill, too. But look, I think the Democratic Party has kind of gotten the message from the White House. We need to pass health reform soon. They spent the entire year on this, or the better part of the year on this, Obama's first year of the presidency, obviously. And to come away with nothing would be just an enormous defeat. It would, I believe, it would truly weaken Obama, truly sort of call into question whether Democrats know how to run the country. And I think voters heading into the polls in 2010 to reelect the House and a third of the Senate would have some serious questions on their minds about whether the Democrats should be running this country. Well,
since you mentioned the 2010 elections, and of course that's the backdrop for all of this, the public opinion numbers are not very high for Congress, and a lot of people don't like what is now emerged as health care reform.
Sure.
So how is this a win in the end for Democrats? Let's say they pass something, and they say, look, we did it. We passed health care reform. And the voters look at it and go, you know, that doesn't really get it. I mean, do they still lose?
We talked to Senator Chuck Schumer from New York the other day, who's probably the smartest political mind in the whole Congress, if you ask me. And his take is, look, it's tough now. No one likes to see the sausage-making process. We're voting on Christmas Eve day. It's pretty ugly business. But once people start seeing, like, hey, I can't get kicked off my insurance anymore because I got sick or my kid got sick, or, hey, my premium might actually be coming down or at least not going up as fast, that the results will make people turn around and say, like, wow, this actually was a good accomplishment for the country. I think the big asterisk on that argument is that a lot of these biggest changes don't happen until about 2014. The National Health Insurance Exchange, the marketplace where we can all shop for insurance and such, that's several years off. So the Democrats have been trying to kind of front load the bill with some goodies. They're going to try to close this donut hole for seniors in the Medicare plan where there's this sort of gap in the coverage. That's one thing they're trying to do next year, and a few other things. So the Democrats will have something to run on in 2010 to say, look, we delivered health reform and here's how it's changing your life. As I say, not all of it kicks in until about 2014, but they are hoping to have something to tout when they hit the campaign trail next fall.
And let me ask you about the other party, the Republicans. They have been in lockstep, just absolutely opposed to this. I think they see some weakness here. Yesterday, the Republicans actually picked off a Democratic member of the House to join their ranks. Is this translate to a Republican win if they are the party of no on this issue and they stonewall? Does that resonate with voters, do you think?
I think what the Republicans are betting is that it resonates with Republican voters and kind of conservative-minded independents. And some of those folks actually kind of came over and ended up voting for Obama last year. I do think they can win the argument that Obama is trying to do too much too fast, spending too much of your taxpayer dollars, and really for a plan, as I say, that doesn't kick in for a long time, and sort of convince people like, hey, we're the only thing that's keeping President Obama from sort of going hog wild on this big government healthcare solution, big government bank takeover, stuff like that. I think there's an audience for that argument. I think there are a lot of folks in this country that are worried that the president is focused on things like health care and climate change and the war in Afghanistan when they wanted to be focusing on jobs. And if the Republicans can show that they are the ones trying to steer him back to the issues that matter, curb some of his more liberal impulses, you might say, I do think some voters will come around to that argument. I do think it's really going to come down to how is the economy doing in about June, July, August of 2010. I think health care, a lot of these other issues will kind of fade into the background. If the unemployment rate is still at 10%, the economy is still sluggish, it will be very hard for Democrats to sort of break through that and say, hey, we gave you health reform. A lot of folks will say, hey, how about giving me a job? So I do think that's the headwinds that the Democrats are sailing into in 2010.
And finally, best guess, look in the crystal ball. What comes first, spring break or health care reform?
Health care reform.
Okay.
Barack Obama will not let this pass February. Period.
Okay. A lot to talk about. Craig Gordon from Politico, thanks for joining us.
Sure
today.
thing.
Really appreciate it.
Yeah.
And turning now quickly to the war in Afghanistan. In this week's version of Unplugged Under 40, Kaylee Hartung talks with Maryam Nawabi, a young woman who's made it her personal mission to explain the American presence in Afghanistan to her countrymen. Take a look.
Maryam Nawabi gives new meaning to the term modern American woman. She's a mother of two, a 36-year-old lawyer running an international consulting firm. She's commuting coast to coast, splitting time between Washington and Los Angeles, and somehow always arrives perfectly tailored. But how different her life story could have been. She was born in Kabul, and her family fled when the Russians invaded Afghanistan.
Being disconnected from a country in conflict, you do feel the need to go back and do something. We feel very lucky to be an American and have the freedom and rights that we have here, but you don't want to forget about the people who didn't have as good of a situation.
So Miriam went to work. As the U.S. government pours billions of dollars into Afghanistan, Miriam is trying to connect and explain her adopted country to the Afghan people.
And then there's a lot of misperceptions then about what the U.S. as a country is doing. So this is one of the few programs that's actually covering these topics directly for the Afghan people, but from the United States.
President Obama's new strategy is to...
Her weekly half-hour public affairs program is produced in America and broadcast to 2 million people in Afghanistan every week.
We do get a lot of older viewers who say, you know, this is the only source of information that we get from the U.S. that's specifically targeted to us, that's speaking to us and not just talking about us.
Older viewers may be a key demographic, but nearly half of Afghanistan's population is under the age of 15. And Miriam is making a special effort to reach out to them too. After every broadcast, more and more young people are connecting with her on Facebook and talking with her on Skype.
I'm just the connecting point for their curiosity about the United States because I'm Afghan and I'm American, so they can relate to me. And so they ask questions. The messages I get from youth there are that they want education. They want to learn something so that they can help rebuild their own country.
It's become a two-way street. On TV, she's trying to help Afghans understand Americans better. In Washington, she's organized a group of Afghan-American professionals to help explain Afghanistan to American policymakers.
Because this is a counterinsurgency and our goal is to bring some stability in the country, we, I think, as Americans need to invest our dollar more wisely. And, you know, there is some level, again, of troops that are needed, but there are other ways, I think, that we can be more effective. The solution, I believe, to terrorism is not more conflict. We have to get to the cause of it, and it's poverty and lack of education. And those are achievable goals.
The role of an activist comes naturally to Miriam. Her father founded the Nuristan Foundation, educating children in the most rural parts of the country and training midwives in areas with one of the world's worst maternal mortality rates. More recently, she and her sisters created Artisan Sarai, an organization connecting Afghan artisans and their crafts with the West. Miriam says her work has convinced her of one thing: Military help may be necessary, but this war won't be won on the battlefield.
This is a new type of war. It's not conventional warfare anymore. It's about dealing with problems like governance and poverty. And that's why it is more complex and it will take more time. And I think the American people have to be more patient and understand that it will take time, but that it is achievable and progress has been made.
We always hear that one person can make a difference, but Miriam Nawabi shows us just how true that is. For Washington Unplugged, I'm Kaylee Hartung.
Thanks, Kaylee. And thanks to you. That's it today for Washington Unplugged. Happy holidays from all of us here at CBS News. Make it a good one. I'm Bob Orr.